Howard Catton joins us now. He's the CEO of the International Council of Nurses. He's live for us from Geneva. Thanks so much for being with us, Howard. You know, arguably no one has been put more at risk from this virus than health workers and the nurses that you represent. We know they've been very brave in so many cases, but do you think they have received due protection and official recognition as well during this pandemic?
It's good to talk to you again, and we are really very concerned that as we hit this milestone of 10 million infections globally, 500,000 people who've died, we're seeing unlocking in some countries and a sense from some that we might be heading towards the finishing line. We are saying very clearly that we don't believe the finishing line is in sight. We think we're still nearer the beginning than the end of this pandemic, and that is so important for people to maintain their discipline and not be complacent, because our health workers, our nurses, have been put under huge strain and pressure. They're exhausted. Some of them are burnt out as well. And if we have more of the second waves, the peaks, the cities and localized incidents of this pandemic continuing, our real fear is that our staff and our health systems will become overwhelmed. So we must continue to take this the virus really, really seriously to support and protect our nurses and our health workers.
Right. I mean, we can see, I think you're saying, by some of the social behavior as of late in countries around the world that health workers are, in a sense, taken for granted. People aren't wearing masks. I mean, we're seeing people actively fighting the mandate that they've received to wear masks to protect not just themselves, but their communities and these health workers. And they're just out there saying no, they don't want to. They are taking these health workers for granted. And let me ask you something then more specific. I mean, do you think it will ever be forgivable, looking back at the last 6 months, for nurses in the richest country in the world to have gotten sick because they couldn't even be provided with the most basic equipment, the PPE, that was needed to protect themselves when treating COVID-19 patients?
We are still not doing enough to protect and prioritize our healthcare workers. We've had this grim milestone of 500,000 deaths around the world. But do you know, we do not know how many of those deaths are healthcare workers, because nobody is counting them. We've done some work and believe that the number of deaths could run into thousands, but countries have not agreed to collect the data in a standardized way. I've said before, and I'll say it again, I think that that is a scandal, because I think it sends a message that we don't support health workers. But more than that, if we collected this data, it tells us, it gives us clues to the fingerprints of the virus. It tells us about issues that we might have in care homes, about a higher risk for Black, Asian, minority, ethnic groups as well. It's not data for data's sake. It's data that can inform improved infection prevention and control measures. And to be honest, nurses say to me, enough with the clapping, act. Give us the support we need. Test us, make sure that you're counting the numbers to inform improved infection prevention and control measures. Give us some breaks, give us some mental health support. These are the sorts of actions we need to see more of for our healthcare workers.
Okay. I mean, do you have any examples, though, of where, you know, we could say kind of the highest standards for healthcare workers have been adhered to, and that this is the model we should be following? Or do you feel most countries have really dropped the ball on how to protect and care for their most needed health workers?
I don't think that any country is perfect, but what we have seen where I think healthcare workers have felt most supported and most protected is where we have nurses, doctors, other health professions who are in the key leadership positions, who've been brought close to the politicians to advise on policy, but also where those countries have then hunted down the virus. They've gone after it. They've tested, they've traced, they've isolated, they've quarantined, they've taken the fight to the virus. They've had very clear public health messages, and they've been trusted by their governments, in part, I think, because their governments have seemed to work very closely with the health professionals. Those, I think, are some of the simple lessons that we have seen from around the world. And in addition, as we were saying, really important that we and all members of the public do the important, basic, but so crucial things around hand hygiene, around social distancing, and around wearing masks as well. These things save lives and protect our health workers as well.
Howard Catton, great to have you. Thanks for being with us. They're live from Geneva.